Hemophilia Treatment Center, or HTC, often serves as the central source of medical care and information for individuals with a bleeding disorder and their families. Many see their HTC and their healthcare team as providing more than just treatment. They see them as partners in care, often over a lifetime. Meet some people who have formed valuable, meaningful relationships with their HTC. Hear how having a strong tie with their healthcare team has benefited them and their entire family.
So my name is Alexandra Johnson, and I have von Willebrand's disease, type 1.
I'm Jen Loving.
I'm Joe Loving.
And we have 3 kids, a 17-year-old daughter, an 11-year-old daughter, and a 3-year-old son with severe hemophilia A, factor VIII deficient.
My name is Josh Heeman. I have a 2-year-old daughter with type 3 von Willebrand's disease. When we first talked with our HTC, our first initial appointment, we've had 2. We've had our second annual visit just this year, as after Kinsey had turned 2, and the first initial visit, there was a lot to it. I guess we had a lot of people coming in. It was very comprehensive. It was very good. Everyone at that HTC we were at has been amazing.
We've got 3 years under our belt. There's still times that if something doesn't seem quite right, we're such on a good level with our HTC that we can call them immediately and be like, hey, it's not that first mother, I'm worried about my kid type thing. They'll know and they'll say, yeah, go ahead and bring them down, or just watch it. Is it hot? Is it swelling? And that type of thing. So that's been where now I feel a little more comfortable with what we're handling. And it's just time, I think.
The nurses have been very accessible. I know they've gotten several emails from me. Just as we've come up with questions, we've contacted them, or if we needed something as far as, working with Kinsey or working with her care, just with her primary doctor. They've been very helpful. So even now, we're very close with the 2 primary nurses we have, and we'll visit with the doctors that we have occasionally, especially if we run into them at our chapter events that we'll have throughout the year. It's been great interacting with them, and the couple nurses that we have the most interaction with probably are, I'd say they're our Kinsey's nurses, but also good friends of ours at this point.
I love our HTC. If I could win the lottery and collect them all in my house, I would just keep them. They're like a family to us. If for some reason we don't, a couple weeks ago, I was sick with a cold and couldn't get Jackson down there, so I called and I said, I'm just not feeling well. I said, we'll just skip it, until Friday, and if they're looking for us the next week. Well, how are you feeling? I mean, it's just like it's a home away from home, which is weird to say about a hospital. But the nurses take such good care of us. The doctors are so hands-on. So we are truly blessed to be in the area that we're at with the HTC that we have. That they're like family. They're not a hospital. They're family.
I didn't know what I wanted to do. I knew I wanted to work in healthcare, but I didn't know exactly why or what I wanted to do until I got into this community and got to know the amazing people I've met. I cannot imagine anything better than getting my bachelor's in BLD and getting my master's in public health, and hopefully someday becoming a pediatric hematologist after going to medical school.